sent out a survey across the country. Most people are not happy with long-term care or the image of nursing homes in the country. And I think the single biggest problem is we have this corporate programming coming out over email and out of these home offices that are, are beautiful places. They don't realize the work. They don't know the work. Right now, I think there's a total disconnect between the corporate programming across not just Signature, across all organizations, and then the workflow needs of our CNA partners. So I think that gap is this big, and Signature HealthCARE goal is to close that gap over time and be one universal care workforce where we're all on the same page without levels.
If you're really going to change long-term care, and if you're really going to fight a revolution, you kind of got to know what it means to be the warrior and the fighter on the front line. Joe basically said, he put the mandate down, we will all become CNAs.
We don't realize the CNA is the backbone of the healthcare system in the United States. And the CNA profession is what drives quality in America today in healthcare. So I think respect for that CNA, understanding these are the top caregivers, understand there's rigor to this program that's going to separate the United States healthcare system as a quality program. And the CNA launch has been a game changer. I got my license in the mail. I received my letter from the state about 2 weeks ago with almost tears of joy because I was fear of failure.
You really don't get the full effect until you're here doing it yourself, how much pride they take in taking care of the residents or their patients, and just the physical demands of the job. I left here yesterday exhausted, and I was only here for 8 hours. And to do this for 40 hours a week, weeks on end, it's just incredible what they've done, the care they give, and how much pride they take in their job. It's been really eye-opening for me.
We get you up, we got to brush your teeth, we've got to get your clothes on. We need to give you the time that you need to do it. Some of our residents don't move very quickly. So you got to, changing beds, finding the sheets, getting them to breakfast, then, then making the bed. So there's this kind of this routine that evolves as well that's basically very physical every day.
We have about 11,800 employees or stakeholders. So you think about that, how large that base is. And for us to take time to see it through their eyes, know the work, learn the intimacy of the partnership, and realize ways we can make that experience and transform it for them.
My day-to-day job is at the home office, so I really never get exposed to the facilities or the residents, and it's just been really somewhat emotional for me. But also just to see all the people working together and how much they care for the residents and how well they know the residents is what really impressed me. I come from a hospital environment. You don't get to know people that well or patients that well. And here, they know their names, they know what they like to wear, and it just really made it personal for me to kind of see that relationship, and then just how incredibly hard they work. Just gives me a whole new appreciation for what they do, and it's just made me, respect them all the more.
You take things for granted, sitting up in the Oval Office, for lack of a better word. I really have a new appreciation for those who wake up at 4 a.m. to be here in the dark, and also for those who are here around the clock overnight as well. Just the sacrifices that it takes to be here and care for the patients.
So this has been one of the best experiences I've ever had in terms of understanding what truly goes on in a nursing home. We were able to actually work with the patients, be a part of it, and be a part of their lives, which is something in my career I've never been able to do, which is very unique. Being the CFO of the organization, it's been refreshing because now I understand some of the things that they need that we need to actually go get right away and go purchase, and then look at a long-term plan in terms of how we could do things better. Overall, I think it's something that I could take to use, go back to the office, and hopefully make a difference, not only based on this experience, but moving forward for everybody.
It's almost like the CNA is really the embodiment of the spirituality pillar of their values, their virtues, who they are, what they can be and what they can do for the resident. The empathy, the compassion, the listening, the meeting them at the very point of need, and not assuming what they need, but listening and meeting them at their very point of need.
Every CEO, every administrator, every manager has got to be a CNA. It's a call to duty for us. I think we talk about revolutionary principles. We talk about it's got to be for the people. This is the one thing that will make us a servant leadership organization. I can just tell you that I've learned so much doing this. And I'm seeing ways to make the company better in the hallways, the rooms, the little small things that make the big difference. So I think it's the start of something special for us. We hope within about 13 to 14 months, we'll have the whole company done. It'll be the first company in the United States to be all CNA certified as a universal care workforce.